Okay, I'm going to demonstrate how to do a intramuscular injection. So here's the order. Okay. Intramuscular injection. The order is 3 milligrams, and the vial is 1 ml per 4 milligrams. And if you do ratio proportion, you should come out to 0.75. You follow BC rules. And one thing we're going to use today, we're going to use this guy here. Today's sorry about that. I'll use a blunt filled needle. You use a filled needle to fill everything, to fill our syringes with appropriate medication except insulin, okay? Because insulin, the needle is already there already for you, so you can't take it out. So what I'm going to do is basically fill needles for non-insulin injections like heparin, Lovenox, Zofran, we call that morphine, and intramuscular injections. We will aspirate every injection except a deltoid injection. A deltoid injection we don't aspirate at all, and we should put out, and the deltoid can only take a maximum of 1 ml. Okay, so we're going to do that. So pretend this is your vial of Zofran, 1 ml per 4 milligrams. So what we're going to do is we're going to take our syringe. Sorry about that. We're going to pull this 0.75. Okay. Then we're going to take our filled needle. We'll turn it, twist it. Then we're going to take this guy right here. This is our vial. We put it in our Zofran vial. We do this. We take that here. We put this here to the cap so we maintain clean, sterile technique. Then we're going to take this guy right here and we're going to inject like so. Okay, now we're going to turn it over. I'm sorry, we're not going to turn it over. We're going to inject 0.75 mLs of air like this. You push it down until it's full of air. Then we're going to turn it over. See, the fluid is up there and your needle's right here. Make sure like that, because if the needle tip is up here and the fluid's down here, you're going to get air, and that's a big huge error. It's a big no-no. So we're going to pull 0.75. I don't know if you can see. There we go. 0.75. Sorry, I'm pulling a little too fast. Okay. And what I'm going to do is I'm pulling it a little bit more. And what I'm going to do is take this out. I know. I'm going to tap your needle. Then we're going to push until the excess fluid comes out. I'm going to push with this. 0.75. I know I'm wasting medication. I'm just trying to get the air bubbles out. And voila, 0.75. Okay, then one-handed scoop technique. Okay, one-handed scoop technique. I'm gonna take this out. Sorry about that. Then we're gonna twist. We're gonna remove this because we don't use the filter needle at all. We never use a filter needle to inject our patients. Then we're gonna go to our 1-inch needle, because our 1-inch needle is needed for an intramuscular injection. So we're going to go like this. Boom. And we're ready to go. And plus label all your syringes. That's the most important you got to do. You got to label all your syringes. Okay, with a name, appropriate, what medication you have, how much is in it, and the route. Make sure you do that. So we're going to do an intramuscular injection. You go like this. Okay. Pretend it's the vastus lateralis. Okay. So we're going to go like this. Real clean in sight. Oh, I forgot to do one thing. Before you always take a vial, you always wipe. Sorry about that. Before you get medication from your vials. I apologize for that mistake. So I take this. You inject. And you aspirate for blood. Okay, if there's any blood, if you pull on the plunger, you pull on this, and if you see blood here, you have to pull out the needle and get a new needle and new medication and new syringe and do it again, preferably in another injection site, because you don't want to inject any blood into the patient. So you aspirate. You aspirate by just pulling on like this like a suction, okay? And if there's no blood, you inject. Okay? I'm not inject the whole thing to my sponge because I don't want to wet my whole entire desk. So you take this out and pretend it's the biohazard sharp. Sorry about that. Biohazard sharp, and you throw it in there, okay? Then you document, and that's how you do an intramuscular injection. Okay?